Hi, Dr. Dio. Welcome to this session. I'm so happy for you to be joining here. Thank you for supporting eye care to be organizing the week awareness they are going to do about sudden cardiac arrest and CPR learning. And I am so thankful to Dr. Rajat from Pennsylvania to be joining here for answering our questions, our queries, and making us more proactive towards this cause. So, to begin with, Dr. Dio, since you have such a wonderful experience in dealing with a sudden cardiac arrest per se in United States of America, from our perspective, from Indian perspective, why do you think learning CPR is important?
Well, first of all, thank you very much for this opportunity. Um, this is obviously a topic that I've dedicated much of my professional life to, and I feel very strongly about. Sudden cardiac death and its precursor, cardiac arrest, still remain the leading cause of death, or one of the leading causes of death in the Western world. And we've now appreciated that it's also one of the leading causes of death in Asia as well. And we've spent much of our time trying to understand what are the risk factors, what is the risk profile that increases the risk of sudden cardiac death. But unfortunately, once cardiac arrest occurs, survival is limited, especially a meaningful survival. Once a patient, once an individual arrests, that means, as you know, that there's lack of blood flow to the brain and to the heart, and essentially every second counts. Meaning that in order for that patient to have a meaningful recovery, it is critical to initiate CPR, cardiopulmonary resuscitation, as soon as possible in order to enhance blood flow or to ensure adequate blood flow to the vital organs, especially the brain and the heart. And unfortunately, most cardiac arrests in the United States, across Europe, and in Asia are either unwitnessed, occur in the middle of the night, or occur in settings where people may not feel as comfortable or have the knowledge in terms of how to implement CPR. And as a result, oftentimes, once the emergency medical services or the 911 response or the ambulance services, once they respond, it's too late. That person has been down for too long. There's the damage to the vital organs, including the brain and the heart, is done, and there's no chance for meaningful recovery. So to answer your question in a nutshell, CPR is critical in order to optimize all chances of survival for the individual who's had a cardiac arrest.
Very nicely put in. Thank you so much. And the most important point, which I understood from your discussion, is that, it is important for a patient who's having sudden cardiac arrest, or for a person who's having sudden cardiac arrest, if he has to survive well with normal brain function, normal heart function, then a person who's witnessing that sudden cardiac arrest should know CPR. That is the only chance of survival, whatever it is. Even if it is a minimum chance, that is the only chance of survival. Otherwise, if the CPR is not started, then the person has no chance to survive, right? So,
No, that's
yeah, please go ahead.
yeah, no, that's absolutely correct. And I would say that, there are a few things. The infrastructure, first of all, in many places, whether it's India or many parts of the United States, are not conducive toward having the ambulance services or the emergency response teams come immediately. There's various technologies, obviously, that are in development and that are being evaluated for that purpose. But we're still at an early stage where we can get our emergency services there in time. And so it really falls on the bystander to initiate CPR. And I will say that if bystander CPR especially in cases of witnessed arrest, is initiated immediately or close to seconds of the arrest, the chances of survival go up immensely. The odds of survival, of a meaningful survival, are quite improved.
Yeah. So little off the track from the questionnaire which I had prepared for you or I had in mind. What percentage of people do you think in US are actually CPR trained? Because I understood from you, it is not only the doctors, the paramedicals, or the ambulance which will reach, which will save the patient. Anybody on everybody around should be, you are generating masses to be trained in CPR to save each and every life. So what percentage do you think in US is trained for CPR?
Not enough.
Okay.
Yeah.
Okay.
Unfortunately, it's not enough. And I'll tell you, in the US, especially in some of the major cities, there have been campaigns, I've been part of these, to mandate CPR training in the secondary school, in the high school, the grades 9 through 12. And I think, I've argued this. I've actually argued this even with my kids' schools, that there's so much time that is spent, for example, on basic health education or on sex education, that I think it's important to spend a couple afternoons on CPR training as well. And as you know, excuse me, as you know, and as with anything in medicine, repetition is key. It's all about repetition and practice.
Absolutely.
And I believe that we should get to a state. We need to work with our governmental officials, our policymakers, our regulatory agencies, our businesses, such that it's part of our wellness culture. So that if you learn basic CPR in schooling, in advanced, in secondary school, then it's repeated, whether it's as part of your job interview or as part of your job hire, just part of your wellness. We all get well checks, right? I mean, it's generally mandated by our employer to have some type of basic health coverage, to have some well check. As part of that, I think, and as part of preventive health, I think it's reasonable to assume that there's some type of CPR knowledge. And then have that continue every several years, just like we would with a driver's license or any other routine activity that requires attention.
I think that's a wonderful thought, Dr. Dio. I have been saying in all my conversations with everybody that whoever is 14 years of age should carry a certificate. Every child 14 years of age should carry a certificate. I am CPR trained and should be proud of it. But what you have put forth today, that even for the job, requirement, it should be a requirement for the job that you are CPR trained. That is a wonderful idea. I will definitely push it forward. And this is a wonderful idea. Thanks for that input. It's a wonderful idea. We can combine both these ideas and move forward in our this muhim to create awareness about CPR. That's wonderful.
I think the other, with your organization, excuse me, with your organization and the influence of your organization across India, I think that it's not just about training. I think spreading the word out on warning symptoms, right? That there's obviously, as you know, a lot of literature to suggest that sudden cardiac arrest may not be so sudden, and that warning signs, warning symptoms should not be ignored. And it's tough. It's especially tough in a country like India with such a large population, limited healthcare resources. What is someone with chest pain supposed to do? That person can't just knock on the ER door every time. But having some type of rapid triage, and this is where I think Indian Heart Rhythm Society may be able to work with technology companies to say, is there a way to quickly stratify who needs to be seen in the ER ASAP by a caregiver, by a physician, and who can wait for his or her next appointment in 2 months? I think it's not going to be perfect, There are going to be misses, but let's use technology to our advantage. There's obviously so many great companies, great technology that have been developed in India, and clearly spearheaded through Indian efforts, that I think it's time to now pour that back into the population to see if we can improve quality of life.
Perfect. Do you think artificial intelligence has a way forward in that?
So I think AI is very interesting. I think AI is very important for multiple aspects of society. I also think AI will be important in what we do in clinical electrophysiology and in treating patients with advanced heart disease and cardiac arrhythmias. But I believe that when it comes to CPR, when it comes to cardiac arrest survival, I think we should stick to the basics. And I don't think we should try to get too complicated here.
Right. Please go ahead.
Sorry?
Please go ahead, Asad.
Oh, yeah. AI is still in an area where we're trying to understand not its methodology, but how best to implement it in clinical practice, meaning how can we use the information generated in AI or using AI methodologies? How can we use that information in our day-to-day practice? That is a gap that we are trying to understand. So when it comes to CPR, there is no gap. We know what needs to be done. We've done this for decades. Our predecessors, prior generations of physicians have understood this. I feel like we're at a point now of implementation where organizations like yours, organizations in the US, like the American Heart Association, they need to really partner, and they need to get the ear of our policymakers, whether it's in the US or India or anywhere else. And it needs to be about education. It needs to be about training. It needs to be about access to the AED, the automatic external defibrillator, across high trafficked areas.
Well, thank you so much for that answer. I mean, it's amazing. I agree, it's education, training, AEDs, knowing about AEDs, all put together from the school level, of course, and, up to the job level even. That should be the way forward. I agree with you. Now, coming back to that bystander thing that you mentioned, I want to understand more because, this, what we are trying to create awareness in people. We have seen so many inhibitions towards people first getting trained for CPR, then actually who know CPR in institution during the CPR to the person who needs it. So can you put your thoughts together and give us more information about that? What is your feeling about it? How can we move forward in that direction, please?
Yeah, it's a great question. We have some of the same struggles and confront some of the similar situation here in the US. I think education, awareness are key. People need to understand that they have the direct ability to save a life, that basic education and basic implementation of CPR can literally save a life. People need to understand that, and people need to feel empowered. That it's that you develop this education, you develop this skill set through a couple afternoons of work, and then go at it. You are ready. We are counting on you. We in the medical field are counting on you to resuscitate a patient so that that patient can then make it to us to see in hospital. I think they need to feel that sense of empowerment, and they need to feel protected, meaning it's not always going to work, that not every patient is going to live. That's okay. You made an attempt. I think, there should certainly not be, it should always just be congratulatory, meaning good work, good try, good effort. This patient may have just been very sick, or may have just been, it was nature's call. And, in the end, we can try to do our very best. But not every patient is going to survive. We all know that through our own clinical experience. But I think patients need to feel that sense of empowerment, that that they have the ability, that they can make the effort, that they can try, and that's it. I also think that there are cultural issues. I think that with bystander CPR, people need to understand anatomy a little bit. They need to understand the chest. They need to understand that below the chest wall is the heart. And when we do CPR, our goal is to compress the heart. That is the goal. There are people obviously that feel uncomfortable to push on the chest. There have been surveys on this. People don't want to do mouth-to-mouth resuscitation. That makes sense, especially in the era of COVID. So I think there's some basic tenets here that we all need to understand. First, look, mouth-to-mouth resuscitation is no longer the standard, right? That's sort of falling out of favor. And what we recognize is that chest compressions are key. So that could be one major message. Chest compressions are key for cardiac arrest survival. And I think once people start to understand beyond just the exterior facade, just beyond, the physical appearance of man or woman, and they recognize that there's the chest wall and below there is the heart, that heart has stopped beating. And I as an individual trained in CPR now have the ability to compress on the chest so that that individual's heart can pump blood throughout the body to vital organs. I think that's got to be the key message, so that our bystanders start to think of our colleagues or the citizenry as people with a heart, and that heart can stop working, and that person's vital organs may not receive oxygen, may not receive the blood required for survival. I think when we start to frame things like this, as opposed to someone who looks pretty in a sari or handsome in a suit, I think we're more likely to make that biologic connection and say, it's our duty as someone who's trained in a skill, who has the ability to improve survival, to help that individual. And maybe then some of our, whether it's cultural or societal concerns, modesty, maybe put aside for the moment so that we can help save a life.
You're right, Dr. Dio. Even I did a survey, I think about 2-3 years ago, and found out that, males may receive CPR more than females. The bystanders are very inhibited. This was an Indian survey, which was done, that bystanders are very inhibited to give CPR to a female person lying on the floor because of exactly what you said, maybe modesty, maybe cultural inhibition, maybe just to the anatomical part of it. So they need to understand, that below that chest wall is the heart, and you need to compress that to save the life. That is the most important message, and I really appreciate you put it in a very nice way. So you know there is a question which has been going on. What is the qualification? What should be the qualification of a bystander who needs to perform a CPR? Now, that's a very generalized question, but that is very important, because people come and ask, can we learn CPR? What do we require to have to learn CPR? So what do you think should be the right person to learn CPR?
Frankly, I think it's anyone that's interested. I think that anyone that's willing to spend a couple hours going through a basic lecture and then hands-on demonstration and in terms of a mannequin model, I think that's all that's required for basic life support knowledge. And I think that if someone has come to you right there and then, he or she has demonstrated that they're interested in moving forward and are willing to take the time to understand understand not just the importance of CPR, but also how to do it. And I think that's all that's required. I don't think we should make it harder than that. I also don't think we should restrict this to adults. I think that there are many kids in middle school, high school, that can learn. I think they're smart. We have a lot of smart kids. I mean, listen, children nowadays are very savvy in using technology and using computers, iPads, iPhones, whatever it is, and they certainly can learn CPR. And I think it's important because, you know, you see these children who are now in 8th, 9th, 10th grade. Their parents may be younger, but oftentimes they're living with other elderly relatives, grandparents, uncles, aunts, you know, close-knit families. That's going to be our first responder. In many cases, that's the first response team. And we need to recognize that. And so we shouldn't be shy of this. I think this is a problem, an area that has been under investigation by investigators across the world for over 2-3 decades. And we understand the importance of CPR, of shock therapy for ventricular arrhythmias, of need to get to hospital. So let's recruit helpers in this process. That's what I think.
So everybody and anybody is a helper for CPR. Anybody
Yes.
and everybody. The more, the better. And you know, the repetition matters, as you said. That we keep on repeating it, we keep on upgrading ourselves, we keep on learning it again and again. We become better at it, and we are actually, that inhibition is also gone to help a person in our vicinity who you know, loses consciousness and falls down. For that bystander, it is very important to give up that inhibition also. That's
Yeah.
very well said. So, as compared to our country, what do you think are the norms which are different in learning CPR in the Western countries? What is the major difference you find, or what is, you know about India? I mean, as much as I do,
Yeah, I think a lot of it probably comes down to logistics, frankly. You know, I think in the US, oftentimes, at least the way I've seen it, CPR is being, I feel like oftentimes the people who are enrolled in CPR classes are ones who are either healthcare providers or are people who have high risk conditions, whether it's themselves or family members. I have been part of some generalized CPR programs that have taken place in gymnasiums, large gymnasiums, and those can be quite effective. And I think that's sort of the model that I see with a country like India, where you have many people who are hopefully interested in learning. And I think, you know, I think having mass campaigns in large centers may be the way to go about this. I also think that it's really important to highlight and emphasize up front to any of these audiences that you are receiving a skill set. You are being empowered. We believe this is important. You also have a responsibility to use this the right way, not to harm someone, and do your best, obviously, but you have also a responsibility to maintain these credentials. You know, that's where the repetition comes in. So people shouldn't be saying in 4 or 5 years, oh yeah, I had the CPR class with Dr. Vanita 5 years ago and I'm all set. It shouldn't be like that, right? It should be,
right,
there's another opportunity to learn.
absolutely.
And we as caregivers should not abandon the effort either. Next year, we should offer training again. It's our responsibility to make sure that we continually provide the access and the opportunity as well. So I think it goes both ways. I think that there are logistical hurdles, especially in a larger, in a more populous country. But at the same time, it's also an opportunity, because I think a country like India will rely on bystander
Hello, Rajat.
CPR even more than what we for survival.
Okay, I lost the last line because of the internet connection. So can you please
Oh no,
repeat? Yeah.
yeah, no, sorry, I'm not sure what happened there. All I was saying is that even though there are logistical challenges with training a large population, I believe that the impact that training individuals in a densely populated country like India, I feel that the impact could also be much more significant than it could be in the United States as well.
Right.
And we have seen, you know, India's actually been quite remarkable. I mean, there have been, I'm familiar with some other public health efforts, large public health efforts in India that have resulted in improvement in mass screening, healthcare screening, and so having a similar platform for CPR across the country could be quite effective.
So you think the campaign that we are organizing for 1 week, that is a mass campaign, as you highlighted and said in the first sentence to answer this question. So mass campaign, this is a good idea and we should continue it. And if we should continue it, how frequently do you think we should continue it?
Well, you know, I think, I mean, first of all, I commend you and your colleagues for initiating this. It's humbling to see. I'm so honored to just even have this small part in it. But I think I would highlight to you that please teach us. Once you have initiated the effort, once you have the experience here, educate us. Tell us what you've learned. What were the strengths? What were the hardships? What worked well? What didn't work well? It's okay. I think we should compare notes across the sea just to figure out what works, what doesn't work. I think you're going to get feedback from from the people that participate.
Absolutely.
And then I will say, I guess I would say to you, you know, an effort like this at least every 6 to 12 months. But that's the wish list. You know, I understand that resources are always an issue, and you know, the time, energy. But you know, what I would say is, if it's important, which this obviously is, if this is effective, which I'm hoping it will be, then there's always a way, right? There's ways to get sponsorships, to get our industry colleagues involved, to highlight to them this is their way of giving back to the communities as well. You know, I think that there's just opportunities, and India has obviously no shortage of talent and creativity. I'm always amazed. It's just always inspiring to me to see what people do there. And I think that's the kind of stuff that, you know, you go to some of the schools and you say, guys, this is what works. Now it's your job to figure out a way to make this more effective, make this more efficient. How can we train even greater masses of people?
So, thank you so much. And but just one last word from you too about you have been so actively involved in ACC. Can you give us some guidance from your experience there? What else we can do to make it better? What different things we can do from your experience with the ACC? Because ACC has really established in a very good way sudden cardiac arrest awareness. They've really done a very good job in that. So I know we are still very far away, but you know, we can be guided.
Well, I think definitely, I think public health campaigns are key. You know, one thing I would say is work with the right stakeholders, meaning you're a professional organization. You're a physician, your colleagues are caregivers or other physicians. So your access is limited, right? Our access as caregivers is limited to patients who come to see us. But oftentimes these patients are part of larger networks. So patients with arrhythmias, right? Support group for arrhythmias. There are social media platforms for some of these disease groups as well. And I would say engage them early. Let them have a seat at the table too. Get their thoughts in terms of how to make a campaign like this more effective. I'd say that, and I think it's also reasonable to say certain communities. I'll give you an example here. In the U.S., communities are often organized by their churches, by their church. So especially in inner cities, like in Philadelphia, where I practice, where my practice is, there may be a large community that attends a certain church. And we have worked with these large congregations, these large churches, to say, we're going to do health screening next Saturday and Sunday. Blood pressure, urine analysis, lipid profile, gun violence, gun awareness, domestic violence awareness, just basic nutrition consults, just some basic education. Doesn't last more than 20 to 30 minutes. Lots of mass lectures, lots of video feedback. I don't know what would be the equivalent in India, to be honest. But if you can direct some of your campaigning, some of your awareness to a group, whether it's a club, a temple, a large community, right? People live in high rises, and say, in this high rise, we're going to have awareness. We're going to have awareness day. That may be one way to start. You need help. It's not just that you can do this, but partnering with local other societies will, I think, be quite effective.
Thank you so much, Dr. Dio. Thank you for taking out the time. I think whatever pointers you have given, we'll make a chart of that, and we'll make sure we work on each and every one of them, and we are better the next time. And of course, I like your idea about exchanging notes about what we learned from this campaign that we are organizing, what challenges we had, and we'll discuss it with you, so that you can even guide us better for the next time. Whenever that next time is, we'll try it within 6 months, but let's see, practically speaking, it should be 12 months, but we can try at 6 months. At least we can wholeheartedly try that. So thank you so much for your input.
I commend you for initiating the effort. I look forward to visiting and to seeing how things are going at some point in the future. But it's remarkable. Your group, India in general, has really set the stage for all of us, and it's really been a remarkable effort. So congratulations and good luck.
Thank you so much, and I thank from the core of my heart from the team of iCare, and from, of course, Indian Heart Rhythm Society, Indian Society of Electrocardiology, Cardiac Society of India, and IMA, the Indian Medical Association. We all have joined hands for this campaign, and thank you so much for sparing the time. And take care. Bye-bye.